people. Today we are speaking about hypnosis and how can we hypnotize a person and let him get rid of his fears. To let you know exactly more about hypnosis, we have those cards that will help us understanding and knowing exactly what hypnosis is. Hypnosis, from the Greek hypnos word, which means sleep, is often thought to be a trance-like state that resembles sleep, but you're still conscious. But it's induced by a person whose suggestions are readily accepted by the other.
So, if I learn hypnosis, I can actually hypnotize you and in between of the program get you standing on top of the table like a sculpture?
Hypnosis will only happen if the guys hypnoting the patient agrees on getting hypnotized. I mean, if I didn't agree, I can leave right away and go through when it's in the very
So it has to be with
stages.
the willingness of the person.
Of course, both guys. More about hypnosis and its use. This technique is sometimes used for medical purposes to relieve anxiety or otherwise improve the altered behavior. Its effectiveness has been clinically demonstrated in many areas, most notably in the area of the acute pain relief, and it also used as a popular stage act in which subjects are persuaded to perform bizarre acts.
Wow, pain relief. That's cool.
Sure.
This is really great, and I'm sure that we will be showing the people with those kind of complicated medical problems another window. You know, maybe they can possibly opt for treatment, and well, for the moment, taking a look furthermore and finding out about the hypnotherapy, which is a term to describe the use of hypnosis in a therapeutic context. Many hypnotherapists refer to their practice as clinical work. Hypnotherapy can either be used as an addition to the work of licensed physicians or physiologists, or it can be used in a standalone environment where there is in question usually owns to his or her own business. So well, this is another interesting factor that you have to be keeping in mind. And well, nowadays, hypnotherapists can help the people to quit smoking, guys. That is something that you all have to be considering, as well as the women out there who are smokers. Often in a single session. So imagine, in a single session, you can get rid of your horrible habit of smoking, which can be chronic when it comes to so many different people because they just want to have something to do with their hands. And as well, it works to lose weight. Psychologists and psychiatrists use hypnosis predominantly for the treatment of some types of disorders, phobias that we are going to overcome today. Saud's big phobia of pointed objects, habit change, depression, and post-traumatic syndromes. There is no evidence that incurable diseases such as cancer, diabetes, and arthritis are curable with hypnosis, but pain and other bodily symptoms related to the diseases are controllable.
Today our Dr. D.ZUHAIR Khusheim is our guest, who will be hypnotizing me and who will tell us exactly about hypnosis and its uses. Will be right after this report about his own life, the Mishmash star. Yes, he is the star of the week in Mishmash.
د.زهير خشيم. Diploma in Psychotherapy, the Coaching and Therapy Institute, UK 2003. Certified member, the National Board of Professional and Ethical Standards Hypnosis Education and Certification, USA 2001. Complementary Medical Hypnosis, National Guild of Hypnosis, Incorporation USA, August 2001. Diploma in Clinical and Advanced Hypnosis, Washington School of Clinical and Advanced Hypnosis, UK 2000. Certified Practitioner of Neuro-Linguistic Programming, NLP, Washington School of Clinical and Advanced Hypnosis, UK 2000. Certified Master Practitioner of Neuro-Linguistic Programming, NLP, Washington School of Clinical and Advanced Hypnosis, USA 2000. Certified Hypnotherapist, National Guild of Hypnosis, USA 2000. Certified Hypnotherapist, American Board of Hypnotherapy, USA 2000. Registered Hypnotherapist, American Board of Hypnotherapy, USA 2000. PhD of Clinical Hypnotherapy, American University, Los Angeles, USA 2000.
And welcome back, dear viewers. After finding out all the more about our esteemed guest for this edition of the program, Dr. Zuhair Al-Khusheim, who is going to be showing us a new perspective on so many things. That is how you even see your phobias. Well, we were really having a very interesting discussion with him off the air when it comes to the different things that he has done and achieved in his life. But for the moment, well, for you, we are presenting Dr. Zuhair Al-Khusheim. Assalamu alaikum, and how are you doing, Dr. Zuhair?
Alaikum assalam, thank you.
So, Dr. Zuhair, how is it that you chose this specialty?
Well, I think of it this way, it's just the power of hypnosis. How can hypnosis make you motivate yourself? Usually, we talk about people, we think about, and this guy is sick, he's having a disease. No, in fact, he's not. The whole idea is have a bad behavior or it's not a recommended behavior. So we're trying here to modify his behavior or modify his thought by using cognitive therapy or using behavior therapy. The guy is okay, but somehow the way he been raised, he have some bad behavior, bad thought which affect him to act this way.
So hypnosis will help us in improving the behavior.
Modifying
the behavior. So what is hypnosis? How can we define hypnosis in simple words for the viewers?
Well, look at it this way. Our mind contains of the conscious mind and the subconscious mind, right? And now you are hearing me on which mind? You are hearing me on the conscious. And the conscious.
The conscious one?
Yes.
Okay.
And taking the information and record it to the subconscious mind.
Sure.
If you want to think of it like, you know, like the operating system on the hard disk.
Okay.
That's one way to look at it, if you like. Okay, now, what we are trying to do here, the conscious mind, you are aware now, you are well, and you are hearing me very well. What we are doing is trying to relax the conscious mind by doing exercising.
Okay.
to relax the conscious mind. Once we do that, the resistance is going down.
From the subconscious mind.
From the conscious mind. Look at it as it's like the gate.
Okay.
I'm trying to enter to the subconscious mind. What I have in front of me?
The conscious mind.
And the resistance.
Okay.
Okay. What is the resistance? Suppose that I know inside me that I am afraid of public speaking. But I have a resistance not to tell you. Can you speak in the front of people? Yes, I can speak in the front of people.
But when I go
when
to
it's come
speak,
to reality, I'm failing. So the resistance here is high because I'm awake.
True.
Once I am under hypnosis, my resistance goes down because I did relax the mind and the body. So the resistance is coming down. It's just like, you know, when they sedate people during operation and they start talking, so the resistance, awareness, it's coming down, it's coming low.
Okay.
So after that we move to the subconscious mind. Where is your record? Is there from the day you born until today. The record of your life is there, the event recorded there.
Do you think we can recall things from our subconscious mind?
Yes.
Like, let's say if Saud and I want to go back to the time when we were 2 years old, do you think that it
well,
is
put it this
going
way.
to come back to
I can
us?
take you back to the 3rd grade and I can tell you if you want, see here the desire. If she wants to know the name of your classmate next to your right and next to your left and who was your teacher, yes. If you have the desire, we can do that. What we call it is age regression.
Okay. Now, hypnosis, one of the major compartments of hypnosis is relaxing.
Relaxing, first of all, relaxing.
Why does it depend on relaxing then?
Because I am going to make your mind busy of relaxing your body.
Okay.
See? I'm taking the attention of your mind, put it on your, concentrate it on your body to relax your body. After that, once the body is relaxed, I go back and relax your mind.
Okay. So you need to separate the mind
I'm
from
getting
the
you
body.
busy.
Yeah.
I'm getting your mind busy.
Because once someone is busy with his body, I mean, his mind will not function the way it has to function.
That's correct. Look at us. We are sitting here right now. So many things is happening, and we are looking at and we're thinking of
So is it like you would make the conscious and the subconscious mind unconscious?
No. The conscious mind only. I need to talk to the subconscious mind.
Okay.
Because that's your record is there.
Doctor.
And think of it this way, if I may add, please. Now, I'm not dealing with somebody who is asleep, because once you are asleep, I cannot talk to you. Can you talk to someone asleep?
Of course not.
Can he hear you?
No.
So you are in a drowsiness.
But not
you are
sleepy,
in a trance.
but in a vegetative kind of a
That's
state.
correct. In between, you are in a drowsiness. Well, that's what we call a trance. It's the state of sleep.
Okay, doctor, I want to know the ability of every person to sleep, and the ability of every person to relax and to get hypnotized. Is there a difference from a person to another?
First of all is the desire.
So who has a desire can do it?
Yes.
Simple.
If you have a desire and a good will, you can do anything. Right?
True.
Okay. Now,
There's a will, there's a way.
there is a will, there is a way. Now, look at us. I am so tense, I am under so much pressure, and I am fighting. That's the problem here. Once I am doing that, my mind is busy, I cannot think clearly, I cannot move clearly. Any noise, any things, any small problem which agitate me.
Okay.
And you have seen people like that. And he said, I'm nervous, I'm always nervous, I'm always shouting. Why? Because the tank is full, he is full. Full of what?
He's
Of
overwhelmed with everything.
Yes.
Tense with everything.
Yes. We don't know how to release that attention.
So can you help the patients who are suffering through chronic depression?
Let's not use the patient, let's use the client.
A client.
Please. Sounds good? Yes, okay. The client.
Doctor, being anxious, nervous, tense, and edgy, does all those, or do all those affect the human body itself?
What do you think? Look at me now. If I am getting nervous and tense, look at me. I'm using my muscles. My muscles are tense. I'm overusing. I'm consuming my muscles. And if my face is tense also, you know how many muscles in the face?
Around 40.
64.
Yeah.
And when you smile, how many muscles you use?
23.
Yeah. See? Almost.
20.
And they are relaxed when you smile. But when you are tense, the whole face So you are using your muscles, your nerve, making a tension. No wonder you see young people, but their faces ages, right? They're getting old.
Is it because they're always angry and
That's
tense and
correct.
anxious?
That is correct.
So I sometimes see people at the age of 90 and 88.
Yes.
Those are people that live their life in a relaxing base.
That's correct.
So to live longer, get happy.
Get happy and relax and discharge your tense, your pressure. We have to know, we have to learn how to discharge.
What if you were in a rush hour, doctor, you need to fly and you're like an hour late for the airport, you need to catch the flight. You can't be smiling on the way to the airport.
That's correct, but what can you do?
Drive fast.
Well,
Okay, and if your kid is shouting, just do anything to him. Just make
if you tell them quiet, let's do this together and help me to get through this. And during the driving, I'm going, I'm letting some steam out.
I hope my father is watching the show, so because always, you know, I'm in the car and I'm rushing to the station, and my father is driving and his hands are shaking, and he is like very worried that I'm going to be late.
Teach him. Teach him.
Doctor, then why do people come to the clinic?
Well, it's not a clinic. I don't want to refer to
the
it.
center.
The center, a
To
training
the specialist,
system.
to the
A
specialist,
training center.
to the training center.
We train you how to relax. It's a training center.
You don't train trainers, you train individuals to apply it on themselves.
That's correct.
Because there is an old belief that if you want to get hypnotized, get a person who can hypnotize you. You can't hypnotize yourself.
That's correct.
I want to change the people's belief about the pendule and the watch.
Yes, that's also
Because they all believe
That's the first thing,
that's the first thing that comes to anyone's mind. And people
Absolutely,
always
you see
say
something moving.
you need someone to do it for you.
Yeah.
Now the new belief
Yes.
is what you're going to tell us now.
That's correct. Well, look at it this way. We have a saying, and we always study this, and you know it. What I think, what I feel. What I think, what I feel. Think happy, you will feel happy. I will tell you a joke, you will tell me a joke, and we all be smiling. Why is she smiling? Have we mentioned any jokes? But she starts smiling. The jokes came to her mind.
I think
What
it's the
you think-
neurotransmitters that give the message to the brain.
Yeah. What you think, what you feel. So it's what you're thinking about. Is that what you feel? Now, I want you to smell your favorite perfume, or smell a scent of mint.
Yes,
Can
you know,
you do
at
that?
times you can just do it from concentration.
From where we get this smell of mint, suppose, right now, or the smelling of mango?
Because we're thinking about fresh mint.
Fresh mint. Okay, so what I think, what I feel. So think of myself, I'm strong. I'm happy.
You feel like
it.
Hercules. Some people
Yes.
think they're strong while they drive the car and they go down to fight someone and they find that someone's stronger and they get beaten out there.
They overexceeded.
They overexceeded
Yeah.
their feelings. So there are limits that we should follow
For everything, there is.
for everything.
Yes.
Doctor, confronting issues that cause a lot of tense, does it depend on the personality?
That's correct. As it was just mentioned that some personalities are weak, some personality are strong, and some personality can deal with the event. And that's what I want to emphasize on today. How we can deal with the event. Okay, I'm late. I'm rushing to the airport. I'm late. What am I going to do?
Nothing.
Is fighting, is getting nervous gonna make me speed? Or
It's a human nature, doctor.
It is a
90% of the
human
people
nature, but
doing
it's
this.
wrong. It's wrong. You know, once you get to the plane and once you get to your seat,
You'll relax.
it will take you 2 hours to come down. Can you imagine that?
2 hours.
2 hours.
This is based on studies.
Yes,
You need 2 hours to be normal.
to be normal. If I check your blood pressure, after 2 hours, come down.
And if you're a noisy person, you'd remind your wife all the trip that you made me come late to the airport.
That's a human nature, as you said. But for how long are we going to be like this? Life as it is speeding now.
Okay, then why does my father and her father and every dad all over the place tell us, what are you telling us right now? You always have to be relaxed and you always have to be quiet and calm. And when he was my age, maybe he was even, more anxious than I.
Well, think of it this way. He's talking from experience. He been through this. He found out his mistake, and he didn't want you to go through his mistakes.
Are the youth supposed to learn from the experiences and gain it as fast as they can?
That's the shortcut.
That's the shortcut.
That's the shortcut.
And what will they be when they grow up? The coldest people on earth?
Well, no, the smartest, how to deal with things again.
Okay.
How to manage things.
That
Think
is,
of it
if you
this
would
way.
know how to manage yourself, you would be able to manage.
A lot
the
of
things
people
that
tell
go
you,
around.
relax. Suppose most of the people, they don't know how to relax. So teach me.
Doctor, you're
So
going
is
to
it
teach us how
like
to relax.
sit back,
Of course.
sit back and take 3 deep breaths?
No.
No.
It's not that easy as it sounds.
Now, Dr.ZUHAIR, is it true that our mind has a power all over our body?
That's
that our
correct.
mind can rule our body? So
Yes.
if we just get the message to our brain that we are happy, we are elated, and we don't have any problems, and you know, we try to have a very positive approach to life, do you think our body is going to respond to that?
That is correct. Think of it this way. The mind is just like a receiver, receive everything. And when you are sitting watching TV, what are you doing? You're changing channel. Aren't we doing the same things here? We're jumping from one thought to another thought to another thought. And one thought make us feel happy and one thought make me feel bad. Is that correct?
That's very true. But doctor,
Okay. So why don't you change? Once you receive a bad thought, why don't you change it? You are in control now.
work tension. Work tension and life-threatening conditions, or let's say career-threatening conditions. This always happens to a lot of employees in companies. I mean, a person whose life depends on the project, he has to submit to the board of members, and he's very tensed. What do you tell those people?
Tense is
What
tense
can you
is
advise
good.
them?
Tense is good. Tense is good. It gives me motive. It gives make me aware, make me avoid making mistakes, and also it gives me a lot of confidence. Tense is good.
But we should never lose control.
That's correct.
Now, Dr.ZUHAIR, choose one thing for me: hypnotherapy or spa therapy. Which one is it that you believe works best, and not because you specialize in a
Both
certain
are the same. Both are the
You
same.
relax in both.
You relax in both, but you're relaxing your body. And in hypnotherapy, we relax the mind.
Because in the spa you listen to music, and the
And this is
music
what they
drives you.
say, that in spa therapy, if you sleep, you would not be able to, untangle. So you need to stay awake. And is this the same thing which is applied on hypnotherapy as well?
In the spa, because of the hot water, your nerve, your body is relaxed, and you feel quiet. After that, the mind have to go
By itself.
by itself. Naturally.
Making my mind relax and making me walking on the glass is right after this report about how to
All
relax.
right.
Have you seen the glass? Yes, I'm gonna walk on the glass, but to be honest, I'm tensed, I'm nervous, and Dr. Zahir told me to walk on such a thing, you need to relax before. Is that true, doctor?
That's correct.
So, what shall we do?
What should we? Can you sit back and ease a little?
But
Okay.
we can hear his heart, tuck, 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 tuck,
Nah.
until here.
You think so?
Yeah.
Okay.
Okay, doctor.
Easy on the chair a little bit if you
Okay,
can.
okay.
Great. Now, you want to relax. Think about relaxation.
Okay. Shall I close my eyes?
Yes, please.
Okay.
And think about your relaxation. Think about like you are walking on the beach. It's kind of fun. Late afternoon. I mean, it's fun. The weather is good. It's beautiful. Switch your thinking to that. Very good. Now, I want you to go to your toe and just move your toes a little bit. Excellent. And keep them relaxed. Great. And look at your legs and feel the heaviness of your legs. Okay, relax them. Every muscle, every nerve in your muscle is relaxed and relax and relax. Go with me now to your hand, from the shoulder to your hand to your finger. Feel them. Feel how heavy they are. Great. Feel how heavy they are. Every nerve, every muscle in your body is relaxing, relaxing, relaxing. You're going deeper and deeper to relaxation. Okay, now your front head, easy on that. Around your eyes, go easy on that. Okay, feel your eyelid. Okay, they are coming down like a curtain. They are coming down. They're getting heavy and heavy and heavy. Excellent. You're doing just fine. Your face, give it a small smile. Yeah. And now we're gonna take a deep breath. Inhale and exhale. Go down one more time. And Exhale and down, deeper and deeper to relaxation. Last time, one more. Beautiful. Feel the quietness in yourself. Feel the quietness in your side. Feel how quiet, peaceful. So quiet, so peaceful. Great. Now I want you to visualize, to imagine, to see number 15, the shape of number 15. 15, 14, go down with me. 15, 14, 13, 12, 11, 10, we're going down and down. 9, 8, 7, 6, 5, down and down, heavy and more heavy. 4, 3, 2, 1, and you are so relaxed. Feel yourself, you are so heavy and relaxed and relaxed. Great. So, feel peaceful inside you, so quiet. Great. See the light in your eyes, take that light and make it inside you. There is a light inside. Feel the light inside you. That makes you feel so good, so nice, so beautiful. Now, what I want you to do, Saud, is I want you to forgive yourself for the past. Just tell yourself, I'm forgetting myself, I'm forgiving myself for the past things that happened to me. I'm forgiving the people who hurt me. Just say to yourself, I'm forgiving myself for what I did wrong. I'm forgiving the people who hurt me. And take a deep breath with me. And relax. One more time. Take a deep one and relax. Feel your chest now. Feel yourself, your inside. How beautiful it is. How clear. Great. Now I want you to put some love inside you. Some happiness inside you. Feel love. Feel happy inside you. And give me a good smile. Yes. Excellent. Now I'm going to tell you 1, 2, 3. On number 3, you're going to open your eyes, feeling fantastic, feeling fresh, feeling wonderful. Are you ready for that? Think with me. Once I tell you 1, 2, 3, you're going to open your eyes, feeling fantastic, feeling wonderful, feeling so fresh. Ready? Okay. 1, 2, 3. How you doing?
Actually, where I was is different from where I am right now.
How was? Explain to us.
I mean, I know. I mean, just when you give
Explain
an area,
the feeling.
When you give an area for yourself and you keep on thinking, and you just isolate yourself from the atmosphere and the surroundings, everything differs on all objectives.
Great.
I mean, what happened to me exactly? I revealed all the memories in the past 2 months.
All right.
And all the bad situations I've been through. Everything. I mean, what came up to my mind are all the people that hurt me in the past 2 months.
Yes.
And right now, if I meet them, actually, I would mind meeting them before, but right now I don't mind meeting them.
Yeah.
That's what I believe, and that's what I promised myself.
How you feel?
Because you told me to promise myself.
Yes. How you feel here?
I mean, you can see a smile on my face.
Yes.
Can't you?
Yes.
Everyone
We saw a smile. You did?
Doctor, let's go right now and see how can a person challenge himself and walk on the glass.
Great. What is the reason behind this? What are we going to do here? What we have to achieve by doing so? Usually most of the students say, oh gosh, the exam is hard for me. What is the idea? He put in his head.
The exam is good.
It's hard. If you send your kids, your friend to do this, to do this, oh, it's going to be hard. No, it's going to be difficult. I cannot do it. Have you ever thought of it, how it's going to be done? Have you taken a procedure, 1, 2, 3, how it's going to be done? So once we're going to walk on the glass now, you're going to tell me it's going to be hard. Most of the people looking at said, oh, it's going to be difficult. How are you going to do that? No, I won't do that. This is dangerous.
No, not difficult. Dangerous, yeah.
Dangerous.
Okay.
Hurting.
Yeah.
Okay, but once we do it, and once we did it, once you're going to do it, what are we going to succeed? What is the statement here?
You prove to yourself, you prove.
You prove what?
Yeah, that you can do anything.
Who gives value to things?
Ourselves.
Who take the value from it?
Ourselves.
Once we go to the exam, this exam is very hard. Okay, so what does that mean? I am modifying myself, or encouraging myself to study more?
No, you're just depressing yourself. You're
Or putting obstacles on myself.
No.
Oh, it is hard, it is hard.
You're just building that huge wall that you can't climb.
Okay. Suppose I got, sense of mind and I went and I studied and I passed the exam. And at the end, I remember my son one time telling me, oh, the exam was easy. Why the exam was easy?
He wanted it to be
because
easy.
he studied. Right? So he went and prepared.
True. Doctor, let's walk on the glass.
Great. Okay.
Saud, you're sure you want to do this?
Yeah, sure, Saima. Of course.
Okay.
We don't have the Red Crescent ambulance waiting outside, Saud.
Great.
Okay.
Now, Masha.
Okay.
Okay, I want you to count how many letters there is and just keep looking at there. And remember how the police people walk, just marching in
the martial walk.
The martial walk, okay?
Okay.
Can you imagine that?
Okay.
Should we start doing that?
Sure.
Okay, give me your hand. Okay, and we're gonna look there and how many round ball, letters there or round ball, and we're gonna just concentrate there and keep concentrating and keep concentrating. Look at it, feel it,
Okay.
think about it, think about it. How many they are?
9.
9, not 10?
Actually, I didn't have the chance to count. I was busy.
Busy what?
I was busy everything.
Everything is busy. How you feel?
I mean, I feel great. Even I had a glass stuck in my leg and it's all good.
So, what did you achieve now?
I achieved a lot, Doctor. Let us sit back and tell the
Okay.
people what did I achieve.
Okay, great.
Okay, I feel the pain now.
Yes.
I felt a bit of pressure because of the little particles, but you drove my thoughts away.
Okay.
And I can do it like a million times.
Drifting the thought.
Yeah. You drifted my thoughts away from it.
And you were thinking about what?
I was thinking about those letters. Until now, 1, 2, 3, 4, 5, 6. It's 8.
8.
It's not 9 even.
Great. What did we achieve here? What did you prove to yourself?
That I can walk on the glass.
And if you walk on the glass, you can do anything now?
True, of course.
Anything reasonable?
Reasonable, yeah. Of course, I can't beat Hulk Hogan or someone. But
Yes.
yeah, I can do anything reasonable. Anything that relies on me myself. That depends on my own.
All right.
Yeah.
So a lot of people say, I cannot go and speak in front of people.
Oh, that's what I get paid for.
Okay. That's what you get. Other people's. That's the social phobia.
True.
I've been invited to this party, to this wedding, and I'm afraid to go. I'm afraid to go. Now, if you walk on the glass, going to that party, what will happen?
Of course, yeah.
We break the fear. We break the fear here.
So a person can relax himself before going to such a speech or before going to a party, and he can go with a lot of confidence and self-esteem to this place.
That's correct. Beautiful.
Even if he rose up afraid from all the society.
Okay. Now, but just one thing. What you said is perfect. Now, to go and speak in front of people, I need to train myself first.
True.
How to do the speech.
True.
Because just relaxing is not enough.
Yeah, because I mean, otherwise you need the material to speak.
Yes.
You need a way.
Yes.
You need a beginning
Yes.
and an end and everything.
Yes.
Yeah.
Believe me. The people you see that speaking in TV, the president, anybody who just stand and speak, he been trained.
And he has a ready speech.
Yes.
Okay. Another report for you people about how to get rid of your fear is here for you, and then we'll be back with a lot of interesting information.
So guys, here I no longer have a smile on my face because I have been totally devastated and shocked from the time that Saud was trying to relax to the time he walked on the glass. And I have been having goosebumps ever since. It's shocking to see somebody do this. This is dangerous.
Are you afraid of doing it, Saima?
No, I'm not afraid of doing it. I'm not afraid of it because I know I'm not going to do it.
Okay. So
What she's saying is that what is the meaning of phobia? Fear of fear.
fear of fear.
Fear of fear. She's not afraid of. She's afraid that she will get
To do it.
to do
Yeah.
it.
Doctor, hypnobirth is a word that I heard before.
Right.
Can you explain to us exactly what is hypnobirth?
Hypnobirth, it's a very, very fantastic technique which helps delivering babies.
For women delivering babies?
Yes.
Okay.
What a woman need for delivery is just relax. To relax the muscles. Once the muscles are relaxed, she can deliver so easy.
So the mom, before she goes to in the delivery room,
Before that, she should learn relaxation.
You should, then women
Trained on relaxation.
Through their pregnancy,
Yes.
should train themselves
Yes.
so that they can apply it
Yes,
when they're delivering their baby.
that's correct.
Doctor struggling or
Stuttering,
stuttering the teeth.
Yes, stuttering. You see a lot of kids when they are talking. Yeah.
True.
I want this. What is happening here?
Are they afraid?
If we did examine that all the organic is correct, so what is happening here?
The brain?
Not the brain and the muscles, okay, the jaw is fine. What is happening here?
He's tensed.
He's tense. Why he's tense? Because when he was young, the teacher asked him, go, get up, answer the question. And it was for him like a monster.
So
he got shocked.
So what should this kid do then?
Relax his jaw.
Relax his jaw.
Yeah.
Doctor, hypnosis is what we're talking about today, and are there any side effects for the hypnosis? For people that hypnotize themselves a lot, and people that are used to they hypnotize themselves 2, 3, 4 times a day. Are there any side effects?
Well, I do advise people to relax. Usually it takes about a minute or so to relax. Just what we did.
True.
Yeah, something like that. And it's a beautiful relaxation.
I mean, of relaxation is nothing to be afraid of. If you relax 3 to 4 times a day, sometimes.
What happening here is this: I'm releasing the steam, I'm releasing attention, I'm releasing the steam.
So it's very safe.
It is very safe.
That's
it is
what
very
we want
safe.
to know. It's very safe.
It's
It's always safe.
Once you are hypnotizing yourself, once I'm putting you in an hypnotizing stage. What I did here, I said, look, think. I'm programming you. I'm making programming yourself to see something nice, something good.
Okay.
Who mind?
No one minds.
Very good.
Everyone would love to.
So there is no side effect.
But doctor, some people say as much as you laugh, I mean, it's in Arabic, كثرة الضحك تميت القلب. Laughing a lot would kill your heart.
No. It's exercise for the heart.
It's an exercise.
Yes, ask any physician will tell you it's an exercise. It's good for the heart. Laugh. It is good. It will make you young. It will live longer.
Always try to be happy.
Yes.
Always be optimistic.
Think the happy. So what makes you happy? Always ask yourself, what makes me happy? Let's do it.
Should we look after what motivates us in life?
Yes, the good things we did in our life. What have you accomplished?
Doctor, if I'm climbing a mountain and I felt at a point that I might fall down. Okay, should I be smiling?
Why didn't you go to that, why are you using the hard example? Use something for normal people.
Okay, something for normal people.
Yeah. Climbing the mountain, you need...
Okay, then the
Walking
important
on the
one.
glass.
Walking on the glass.
Believe me, I didn't have this fear. I went, and because doctor drifted my mind away, and I did it.
Well, I just wish that Saud, your mom, never watched the show.
I told her before to watch the show, and she freaked out. And I'm pretty sure right now she's enjoying that I'm still okay.
If you want, we can go through this, and you can walk on the glass.
No.
What? You don't want to?
Doctor, a lot of negative personalities surround us. How can we deal with those people?
First of all, just get relaxed, get rid of our pressure and tense, and relax. Learn how to relax. That's my advice to everybody.
Learn how to relax. You don't need a specialist to be with you all the time. You can specialize on yourself.
If I bought a ball here and I start punching that ball, I'm gonna be like Leonardo or those famous guys?
No.
So what do I need? A coach.
True.
Okay, so for the first time you need a coach.
You need a coach.
For the first time.
You'll be the coach of your own.
Yes.
Dr. Zahir Khusheim, thank you very much for coming to Mishmash and for making me walk on the glass and for everything you did for us today.
It is a pleasure.
It's a pleasure for us. A small thank you gesture is always ready from Mishmash that we usually give to our guests and is ready with Hakeem to give you.
Okay.
Hakeem, don't walk in the glass, please. Okay.
Shukran. MashaAllah.
Shukran, Hakeem. Yeah, if we can go to the camera, Doctor, it will be wonderful. Yeah, and this shows Dr. Zuhair hypnotizing a patient, and this patient just relax.
Okay.
Relax, Doctor.
Yes. Yes.
Simon, what is the answer for today?
Well, the answer for today is very, very easy, and it was Prophet Isa, peace be upon him, that we were talking about. And well, dear viewers, I really hope that this edition helped you all overcome your fear, and all of you have found out how to relax, and that your mind has the power of your body.
The person that has to relax at the moment is Saima. You see that she is very overwhelmed and very anxious. We'll try our best to relax Saima for us tomorrow. Today is a wonderful debate day, and with a surprise for you to watch. Just keep tuned on Channel 2 tomorrow, 4 p.m. to watch. And as you know, I'm happy because I did what I was afraid of. See you then.